In this morning's Women's Doctor, aches and pains come with aging, but back pain, boy, it can really take you down. Joining us live this morning with more on what you can do to help is Mercy Medical Center Dr. Maxim Schleichoff. Good morning.
Good morning.
So back pain, something that so many people experience, but it can really run the gamut of mild to moderate to severe.
That's correct.
So what are some of the general causes of back pain?
General cause of back pain, usually it's a muscular strain, it's wear and tear on the back over time as people age. And the good news is most of the time people get better. 90–95% of people get better within 3 months with just some time and conservative care.
Because some of us wrench our back when we're picking up something heavy, or we haven't been wearing the proper shoes and standing for a long time. But there are some cases that are more severe, like a pinched nerve, and that's when you really need to see a doctor.
Exactly, and especially if you're experiencing severe pain or weakness, that's really a really important reason to come in and be seen quickly.
When do you know it is time to seek a doctor and maybe just kind of escalate your care for that?
Yeah, I think it depends on the severity of the symptoms. Some people will prefer to try a few things at home, try some ibuprofen, some Tylenol, rest, and if those things aren't helping, then that's a good time to maybe consider being seen.
And what's your take on this one, ice versus heat?
I tell people, try both, see what works for you. Ice typically is a little bit better for inflammation. Sometimes heat can be helpful as well, but it's good to alternate and not use one for any long period of time.
And people also, when they experience back pain, they may not want to turn to, so many pills like maybe the Motrins and things like that. What other treatments are available? Yeah,
so other than medications, there's physical therapy, which has been shown to be helpful. Other than Motrin and Tylenol, there are muscle relaxants, there's nerve medicines that help with nerve pain, there's steroid medications. So a lot of medications that aren't narcotic medications that a lot of people are worried about. And then sometimes injections can be helpful as well. So there's a lot of things that we can try short of surgery to help people.
I was going to say, it sounds like there's a lot of options out there, but that's really, a conversation you should have with your doctor about what treatment should work best for you.
Exactly.
And I know as doctors, you guys don't like to jump straight into surgery either.
No.
Yeah.
No. My philosophy is to kind of work up the invasiveness of treatment. So, therapy, medications, injections, and, if symptoms are severe, if people have weakness, then that's when we talk about surgery.
All right, Doc, thanks so much for joining us this morning.
Of course. Thank you so much.
Of course.